So friends, we'll discuss today a very important drug, that is the digoxin. So we'll discuss this drug digoxin. So when we are giving this drug in a patient with heart failure, so the patient with heart failure, if they are not improving with drugs like ACE inhibitors and drugs like diuretics. So if a patient with heart failure, he is taking ACE inhibitors and he is taking diuretics, and his symptoms is not improving with these drugs like telmisartan and diuretics like we have this Lasix. If they are not improving with ACE inhibitors and diuretics, then we are going to give such patients the digoxin. This is one very important indication. Another indication of using the digoxin is those patients who are having the heart failure. Along with heart failure, these patients having the atrial fibrillation. So if a patient present to us having the heart failure, and on the top of that they are having the atrial fibrillation, and now in this patient we are requiring the rate control, and in that condition we are going to give the digoxin. So the digoxin, the two very important indication of digoxin is that if the patient is not improving with ACE inhibitors and with diuretics. And another important indication, if the patient requires the rate control, if the patient is having the atrial fibrillation along with heart failure. So for rate control, we are going to give digoxin in these patients, and if the patients are not improving with ACE inhibitors and diuretics, we are going to put the patient on digoxin. So now what is the half life of digoxin? So it is a I'm going to tell you that it is a very long acting drug. So the half life, the drug becomes half, that is 50%, it remains in the body even after 1 day. So the half life is about 24 to 36 hours. So if the patient today has taken the drug, it remain in the body up to 50% even after 1 day, that is 24 hours. So the half life of this drug, it is a very long acting. The half life of the drug is 24 to 36 hours. Now what is the route of excretion? From where it is excreted from the body? It is excreted through kidney. So kidneys excrete the digoxin from our body. So the kidneys are the organs which are going to excrete this digoxin out of the body. Now if we are going to put the patient on digoxin, we have, if we want a very early effect of this drug, we are going to load patient with digoxin. So what is the loading dose? If we want a very early effect, we have to load the patient with digoxin, and the loading dose we are going to give over 1 to 2 days. So what is the loading dose? Loading dose is 0.75 milligram to 1.25 milligram over 1 to 2 days. So we want the patient having the early effect of the digoxin, we give the drug, that is the 0.75 milligram, and we can go up to 1.25 milligram. We are going to load the patient with digoxin. Then after the loading dose we are given the patient, then we maintain the dose. So what is the maintenance dose of digoxin? We have given this loading dose, and now we are going to maintain these levels in the body. So the maintenance dose can go from 0.1 to 5, it ranges from 0.125 milligram, which we are going to give 3 times per week. We are going to give 3 times per week, and it can, or we can go 0.5 milligram once daily dose. So the maintenance dose, either we can give 0.125 milligram 3 times in a week, and it can go up to 0.5 milligram once daily. So if you are going to maintain the patient for these levels, you can either give the 0.125 milligram 3 times in a week, and or you can give 0.5 milligram once daily. So this is the maintenance dose of digoxin. So the dose has to be reduced in those patients, the maintenance dose has to be reduced. If patient is old, the dose of digoxin has to be reduced. If the patient is old, patient is having deranged kidney function, kidney is compromised, then we are going to reduce the dose. And also we are going to reduce if the patient is having the body weight is less. So in this condition we are going to reduce the dose of digoxin. Now there are certain drugs which are going to increase the level of digoxin up to 100%. So if the patient is consuming certain drugs, the level of digoxin increased inside their body up to 100%. So what are the drugs which are going to increase the digoxin level? These are the drugs like amiodarone. Amiodarone going to increase the level of digoxin. Along with amiodarone, we have the quinidine. Quinidine going to increase the level of digoxin inside the body, and verapamil. So these drugs going to increase the level of digoxin up to 100% inside the body. And there are certain conditions that can precipitate the digoxin toxicity. So digoxin toxicity can be precipitated by if the patient is having the hypokalemia. So we must check potassium level before giving the digoxin. If the hypokalemia is there, the digoxin toxicity will increase. Also, if the patient is having the myocardial ischemia, the digoxin toxicity will further increase more. So we have to rule out this condition, and then we are going to give the digoxin to the patient. So what levels that should be remain for desired optimal effect of digoxin? It should be between 0.7 to 1.2 nanogram per ml. It should be in nanogram. So the level must be between 0.7 to 1.2 nanogram per ml for optimum digoxin effect. But if the level of digoxin becomes more than 1.8 nanogram per ml inside the body, then you are going to cause the toxicity of digoxin in the form of ventricular arrhythmia. So the toxicity can be precipitated if the level inside the body becomes more than 1.8 nanogram per ml, and it can precipitate the digoxin toxicity in the form of ventricular arrhythmia. So this is all about the digoxin. Hope you like it. If you do like, please stay tuned for further updates. Thank you.